Hello and welcome to all of our advisors and our ambassadors and community members who have joined us online today. Today is Thursday, October 29th, and today is our 30th virtual community meeting. My name is Deborah Volleson, and I'm the Director of Community Engagement for Kuwa Delta. And as I say at the beginning of every webinar, these meetings are just to keep you up to date on what is happening at our hospital. These last 8 months have just been filled with confusion and changes, and I hope these meetings have answered the questions that you've had. We will post this recording on our COVID-19 page on the Kuwa Delta website, and then of course it will be posted in the private community engagement Facebook page. Before we get started though today, I wanted to give a shout out to Daniel Baker, our IT Service Delivery Manager, who has been with us almost every one of these webinars. Now, Gary, if you will remember, we started off kind of shaky when we moved into the virtual platform. And those of you who joined us at the very beginning, you remember the day that I got frustrated with the feedback and just disconnected everybody. But since Daniel has been here, everything has ran smoothly. And I call him the most educated man about COVID on this campus next to Gary, because he has sat and listened to these answers, and sometimes he mouths them along with Gary. So I just wanted to give a quick shout out. And then of course it's always an honor to sit with our CEO, Gary Herbst, and discuss the questions that you submit during the week. I have said several times over the last 8 months that I'm not going to panic unless I see Gary panicking. And you've been relatively calm.
Yes.
There might have been a couple of weeks where you looked a little panicky.
When they talk about a duck, calm on the top of the water, but paddling like crazy underneath.
Yeah. Well,
there have been some of those duck days along the way. So,
yeah, but we appreciate your calm demeanor,
thanks.
because you've definitely led us through this pandemic. And so welcome to your 30th webinar.
Wow, so silver is 25 years. I know we're not in years, we're in weeks, but we should.
Here's Kuwa Delta math for our 30th.
There you go. Thanks. Well, thanks, Deb, and I couldn't agree with you more about Daniel Baker. Daniel's been such a huge part of our weekly productions and has definitely taken us to such a higher level of production quality and sound quality, and now we're actually using our own marketing resources, our own Kuwa Delta talent here to behind the cameras are now managing our studio here. So we've come a long way in 30 weeks. That's for certain. Also, I am so happy that we are doing this broadcast on Thursday and not tomorrow, because while Halloween is on Saturday, Kuwa Delta will be celebrating Halloween tomorrow, as many of our 5,000 employees, including myself and our whole executive team, will be dressing up in costume. And last year we were hippies. This year we're adopting kind of the theme from the 50s. We all remember the show Grease. So tomorrow I'll be doing my best John Travolta imitation or whatever. So, and I'm hoping that as little of that gets caught on film as possible.
I was just going to say, I hope our team gets the
I'm
singing
sure they
and
will.
dancing
I'm sure they will
screen.
be out with their cameras everywhere. But so thanks for having me here. I know we always like to start with the numbers.
Yes.
So hot off the press, start at the state level, then go down to the county level, and then right here at Kuwa Delta. So since the beginning of the pandemic, which was early March, kind of mid-March, the state now has performed 18.2 million tests across all 58 of its counties. There have been 909,000 confirmed cases of COVID, which translates into a cumulative positivity rate over the entire pandemic of 5%. So 5% of those 18.2 million people that were tested tested positive. What's more important to us is what is the more recent positivity rate, because that really gives us a sense of how this pandemic is ebbing and flowing, and are we seeing improvement? Are we sustaining that improvement? But these metrics are also key to reopening our communities, our businesses, our society, our churches, our gymnasiums, our schools under the governor's blueprint for a safer economy. So at the state level, the 7-day positivity rate is actually up. It's ticked up almost a full percentage point. So we're now at 3.3%. Recently, they were down around 2.3%. And then the 14-day average is around 3%. So definitely we're seeing over these last 7 days at the state level an increasing positivity rate. We've seen that at the county level, and we're seeing that across the country and across the world. So we'll talk more about that. So of the 909,000 California residents that have contracted the virus, sadly 17,475 have died because of the virus. That represents about 1.9% of those people that contract the virus end up succumbing to the virus. And over the last couple months, that rate is held relatively stable at about 1.6, 1.7. So again, a bit of an uptick at the state level to 1.9. That translates into just shy of 44 deaths per 100,000. So just kind of keep that number in mind as I move to the county level. So at the state level, we're seeing about 44 deaths per 100,000 population. There are currently 2,342 of those 909,000 COVID positive patients that are in the hospital. So that's been a really positive trend that we've seen, that even though we've seen an uptick in the number of COVID cases, those requiring hospitalization and those dying of the virus, we have seen that decline. So to only have 2,342 patients in the hospital, and this is across California, all California hospitals, is encouraging to see. And of those 2,342 that are currently hospitalized, roughly 28%, 663 of them are in the ICU. And again, that number, that's probably down slightly because it had been running at a pretty constant 1/3, right around 32, 33%. So fewer hospitalizations, and then those that are hospitalized, fewer slightly that are requiring critical care level services. In terms of healthcare workers, they've actually fared much better than the rest of society. And I suspect that we work in a lot different environment. We work in a very sanitary environment where we're wearing extensive personal protective equipment and employing disinfection techniques and protocols and so forth. So of those 909,000 Californians that have contracted the virus, roughly 44,000 of them were healthcare workers. So less than 5% of all the Californians who have contracted it were healthcare workers. And far fewer deaths. Of those 17,475 statewide deaths, only 203, or 1.2% of them, are healthcare workers. So that obviously is very positive, that the people that are taking care of our communities, providing the healthcare needs, have managed to remain relatively safe. So moving down to the county level, the countywide, and this includes all testing sites, we've performed 163,000 COVID tests since the beginning of the pandemic. We have 17,800 confirmed cases, so 909,000 at the state level, 17,800 within Tulare County. That translates into a cumulative positivity rate of 10.9%, so more than double the 5% that we see at the state level. So we definitely have had a greater outbreak here in Tulare County than other parts of the state. In fact, Tulare County still ranks 4th among the 58 California counties in terms of the positivity rate. Or in terms of the number of cases per 100,000 population. We also, unfortunately, we rank 5th in the state in terms of the number of deaths from COVID per 100,000 population. So that's our cumulative positivity rate. Again, we're more interested at the county level in the recent positivity rate, and we've seen a vast improvement, since the beginning of the pandemic, moving from this 10.9% cumulative positivity rate to only 4.6% over the last 7 days. That 4.6% actually puts us in Tier 3 of the governor's blueprint for a safer economy. Tier 3 is orange, so you have Tier 1 purple, which is the most restrictive, widespread COVID outbreak. Then you move into Tier 2, which is red, then Tier 3, which is orange, and then Tier 4, the most liberal, loose restrictions, so Tier 4, which is yellow. So in terms of our overall positivity rate, we're well below the 8%, that if you're above 8%, that keeps you in the purple tier, the most restrictive. So amazing to see that we've dropped down to 4.6%. And remember, the numerator is the number of positive cases, the denominator is the number of tests you performed. So that's why we want to do more and more testing if possible, and ideally test people that are virus-free. So then you get 0 on the numerator and 1 on the denominator, and your positivity rate is 0 in that case. So I think that positivity rate falling to 4.6% is a reflection of more testing occurring throughout Tulare County, but hopefully also fewer positive cases. The health equity positivity rate, which I think I spoke of extensively at our last telecast, and that is that same positivity rate, but it's the positivity rate that is observed in the census tracts. There's 77 or 78 census tracts throughout Tulare County. You divide them into quartiles, and then those that have some of the lowest health factors, that probably has your most vulnerable population, a lot of congregate living, higher risk of infection, probably less access to testing and even medical care. How are we doing in those areas of the county? And very pleased to report that positivity rate for that lowest quartile census tract area is down to 6.6%. So again, well below the 8% that would put us in Tier 1. It would move us into Tier 2 red. So overall positivity rate, Tier 3 orange. Health equity positivity rate, 6.6%, so Tier 2 red. But unfortunately, lastly, the third metric is the number of new cases that we detect every day over a 7-day period. So that's the adjusted new daily case rate. And unfortunately, it's reported every Tuesday by the state. And this last Tuesday, and what the county is reporting right now, is we're at 8.3. 8.3 per 100,000 population of daily new cases. So you have to be below 7. So we have to see generally below 33, below 32 total cases per day. So we've been higher, we've been lower. Unfortunately, again, we've had kind of a slight tick up just over the last 7 days, which I'll mention in a moment here. But all three of those metrics, for you to move, or us to move into a less restrictive tier, have to be in that less restrictive tier or better. So unfortunately, they take the worst metric, and if that falls, whatever tier that falls into, that's what you're classified. So even though we're orange and red in 2 metrics, we're still purple in that last metric, and so unfortunately we're still in purple, Tier 1, most restricted. So now finally coming down to the local level, as of this morning, we have 29 COVID positive adults that are in the acute medical center. We had 1 positive pediatric patient, So a total of 30 positive cases, and then we have 2 more adults that are suspected of having COVID, but we're waiting for their test results to come back. Generally, somebody that's suspected generally ends up being positive. Mm-hmm. So in all likelihood, we've got 32 positive cases today in the hospital. Contrast that with just this most recent Saturday. Last Saturday, we only had 14 total positive cases, and we were all celebrating. We've seen that number continue to come down, hit that low mark of only 14 on Saturday, and starting to feel really good. But we were, obviously reading at what was going around across the globe, and then across the United States, the Midwest in particular getting hit hard. I'm down in Southern California, right on the border, El Paso and Mexicali, and just getting hit incredibly hard. But now, just 5 days later, we go from 14 to 32. So we are worried. The celebration was rather short-lived, and just reminded us that we can't relax. We can't, say, all right, it's over. I think that's what the virus looks forward to, is that we just, it needs a host. It loves lots of hosts, and so we just got to continue to be really vigilant, as difficult as that is. Of those 32 patients that are in-house, again, fortunately, we are seeing less intensity, less severity of their infection. We only have 6 of those 32 COVID patients that are in the ICU right now. We do have 7 patients that have been intubated. They're on a ventilator, so of the 32. Somebody asked me, I did a telecast with the Tulare Chamber of Commerce early this week, and they wanted to know how many total positive cases have been admitted to Kuwa Delta since the beginning. And we are, just like we're celebrating our 30-week anniversary here, we've now pretty much hit the 1,000 mark. We have now admitted 1,000 COVID-19 patients since the beginning of the pandemic. While our COVID numbers are relatively down, the hospital continues to be really, really busy. I know that's a frequent question I'm asked. The acute medical center, the adult occupancy rate right now today is at 87%. We only have 11 ICU beds open across our 2 units, and only 10 intermediate critical care beds across our 2 units. So not a lot of elbow room right now, which is what contributes to our nervousness, because we certainly want to see hospitalizations, COVID hospitalizations, stay down, particularly as we prepare to go into flu season. And then the last thing, in terms of our number of employees, as of Tuesday, Diane Cox reports out every Tuesday, we've had 385 Kuwa Delta employees that have tested positive, again, since inception. 26 of them are still out on leave, so virtually all have recovered. And again, that's a relative term. Right. And are back to work. We've had 13 providers, physicians or advanced practice providers, that have tested positive over the pandemic, and none of them are on leave at this point. So all 13, one of our providers unfortunately did pass away a few months ago, but the others have overcome the virus and are back at work.
Okay, the intubations, 7, that seems like a high number. Should we be worried about
7 of the 32?
Yeah, that seems kind of high.
Not necessarily.
Okay.
Because you think about it again at the state level, 28% of the patient, or 28% of all those COVID patients that are in hospitals right now are in the ICU. And generally, if you're in the ICU, you're intubated. So the 6 patients that we have in the ICU, every one of them is intubated. So, so we're right.
So that's kind of following trends.
We're about that 28%, maybe slightly lower. So we're kind of following the trend.
Okay. So we have a chat. It would seem that Tulare County has more deaths per day than would be expected as a percentage of deaths statewide. Do you see trends in that regard?
Yeah. In fact, I'm sorry I skipped over that. Thank you. So yeah, going back to the county level. So as of today, the county is reporting 292 total deaths. 119 or 41% of them are nursing home or were nursing home patients. That translates into 60 deaths per 100,000 population. So at the state level, they are running at, what did I say, 44 deaths per 100,000. Tulare County is at 60 per 100,000. It's the reason that we rank 5th in the state. So we have the 5th highest number of COVID-related deaths. Or of the 58 counties, we rank number 5. The lower you are, the higher your death rate. So yes, we do have a higher number of deaths, and there's probably a lot of socioeconomic factors that contribute to that, because most of those patients that have died of COVID had an underlying chronic condition. One of the more prevalent ones being uncontrolled diabetes. Tulare County has one of the highest rates of diabetes in the entire United States relative to its population. We also, just the agricultural nature of our society here, the fact that we have the highest Medi-Cal enrollment. 60% of all of the people that live in Tulare County are enrolled in the Medi-Cal program, which means you're essentially living at the federal poverty level. Impoverished families, tend to have a lot more congregate living because it's unaffordable to own your own home. So you share homes with larger families, which raises your infection risk rate. But I just think there's, definitely a number of factors that Tulare County has, just health factors that has contributed to a higher number of cases and certainly a higher number of deaths.
Right, okay. So you mentioned the uptick in our positive cases in our county, but our numbers, although we're not happy that they've gone from 14 up to 32, that's still, the numbers are still low.
Right.
So what are your thoughts on that? Are just younger people testing positive? Are the symptoms getting easier to control? Are our staff getting better? Are all of those things?
It's interesting. In preparing for this morning, I looked at the daily email that Jerry Martin of our ISS department sends out. It's the same information that we post on our website and social media every day. But I've always been curious about the age distribution of COVID cases relative to those folks that are testing positive versus the age of those that actually end up being hospitalized. And it's almost a complete opposite relationship. So over the last 14 days, 64% of the patients that were tested positive by Kuwa Delta, 64% were younger than age 50. So a disproportionate number of younger people, those that are younger than 50 years old, are testing positive. But in terms of hospitalizations, 67%, this is over the last 14 days, 67% of the COVID positive cases that were hospitalized were over 50 years old. So what it tells me, and we've kind of known this all the time, is that younger people, maybe they haven't been as alive as long enough to maybe develop all these underlying chronic conditions, hypertension, diabetes, congestive heart failure, asthma, although we know asthma strikes a lot of young people. But younger people that can track the virus are able to fight it more successfully and don't end up being in the hospital. And so I think we're seeing the uptick in the number of cases is because we're testing more people countywide, so we're just going to detect, more cases. And we're detecting asymptomatic patients. So we now are testing really anybody that wants to be tested. And so we're gonna test people that don't seem sick at all, but they actually have the virus. So that's why you see the uptick in cases. but you don't see as many hospitalizations is because they're able to fight it so well. I also do think that somebody asked, are they more mild? I don't think they're really more mild. I think one of the things is they're getting to the hospital sooner. I think that's a message that we've really tried to get out there, is don't wait until you're on the floor at home and you can't breathe and you have to call the ambulance. You know, get in, see your doctor,
Right.
come to the emergency department if you're struggling to breathe, because the earlier we can start treating you with remdesivir or dexamethasone, steroids, we just have such a better recovery rate and a shorter hospitalization.
Okay, so we're not really seeing the rise reflective in the employee positive numbers.
No,
we only have 26 on LOA, so
right.
that's okay.
And again, that's PPE has become more and more available throughout this course. We've continuously changed our protocols. We now, we had a meeting just yesterday. Are we at the point where we can now do a single-use N95 mask? So it means that every single time a nurse, if I'm a nurse and I'm taking care of my 4 patients, every single time I go into the room, I put on a brand new N95 mask and I throw it away as soon as I walk out of the room. The next hour when I go back in, I put on a new one. We estimate that we'll go through 4,000 N95 masks a day if we adopt that. But we're on the cusp of being able to move there. So I just think the fact that we've, PPE's become more plentiful. We've also learned a lot. We're doing a lot more disinfection. Just things like that are just reducing our employee exposure numbers, at least at work.
Right.
I mean, obviously they still are at the same risk as the general community when they leave work.
Right. So do you know what's causing the spike in the Midwest? Do you have any thoughts on that?
Just what I read. It's the same thing. I mean, it was on the front page of the Times Delta this morning. Tim Lutz, the Tulare County Health and Human Services Agency Director, really attributes it to gatherings. Large gatherings, mid-sized gatherings, churches, unfortunately, allowing parishioners to worship inside the churches despite the violation of the governor's orders. There are people, I heard about a restaurant serving breakfast indoors and allowing people in there and not having to mask, and we hear about gyms that are open illegally and allowing the people to come in and work out without masks, and that seems to be the origin of the spread, is that it's the human-to-human contact. The CDC even revised, it used to be that the CDC said you had to be in constant contact with an exposed person for at least 15 minutes for the virus to be able to successfully pass. Now they're saying, accumulative, if you happen to, accumulate 15 minutes in a day, so you may only a few minutes at a time, but if it accumulates to 15 minutes, the virus has not diminished in any way. It hasn't become weaker. And so I guess get back to the question is I think the Midwest is, they're just experiencing the same thing. People getting frustrated, restless. I can't, we've been doing this for 8 months.
Yeah.
I just can't do it. So I think that's why we're seeing it in the Midwest, but it's not just isolated to them.
Yeah, but isolation is so hard. And
it
we
is,
understand
absolutely.
that.
I mean, you look at European countries, just reading this morning about Germany and maybe it was France, getting ready to go down into lockdown, closing all their restaurants, all their bars, mandatory shelter at home. So it's come roaring back in the European countries as well.
Well, that's a bummer. Okay, so we have a chat. Have you encountered a situation where a person tested positive, they don't have a temp, yet the county explains that the person can return back to work in 3 days without a temp? Does that then require a negative test to return?
I have not heard that. That if somebody, I mean, again, many people are asymptomatic. They estimate as many as 50% of people that have the virus exhibit no symptoms whatsoever, including no rise in temperature. But if you happen to test positive, you're contagious. And in fact, they say that the first couple days of contracting the virus, you're the most contagious. So if we would strongly advise anybody that tested positive, even if you didn't have a single symptom, including rise in temperature, you should be home quarantining yourself. You should not be going back to work. And that's real surprising that if that in fact is what the county is advising people. I'll circle back with our team that speaks very frequently with the county. I'd like to think that that's just misinformation that's out there.
And we're not requiring negative tests. We're requiring them to spend so many days in quarantine and then...
Right. We do what's called time and symptoms. So if one of our employees tests positive, whether they had symptoms or not, we require that they quarantine at home for 14 days. We check in with them frequently, and if they, at the end of the 14 days, they are feeling well and exhibiting no symptoms of the virus, then they can come back to work. Obviously, when they come back to work, they're wearing all their PPE and protecting themselves and others, but we do not require them to take a test and they come back negative. Because what we've learned is that the dead virus cells can live in your body for months and months. We've had patients and employees that did get another test several months after they after they first tested positive, and they test positive again, but they're not contagious, and the virus is dead, but the cells are still being picked up, particularly by the really sensitive PCR tests. So that's why we kind of moved away. That waiting to get a negative test is really kind of fruitless, because you may never get one.
So do you have any projections about when a COVID vaccine is going to be available?
No, my guess is as good as anybody's. I mean, James McNulty, our director of pharmacy, he's kind of on the cutting edge of just being at the front lines, learning about and there are many different vaccines that are being developed by many different companies. Pfizer, Moderna, AstraZeneca, I think, is one of the companies. Moderna and Pfizer seem to be kind of the front runners in terms of where they are in the vaccine development. Obviously, we've learned some pretty interesting things about these. The vaccines have to be stored at a temperature of minus 70 degrees or minus 100 degrees. So you have to have special freezers to store these vaccines. And so you think about just the logistics of transporting them, distributing them, storing them, how long. I mean, you're not going to inject somebody with a liquid that's at 100 degrees below zero. So at what temperature do you then administer that vaccine? But the county is buying a freezer for us. They actually reached out to us. They're going to buy one of the minus 100 degree freezers. We're going to look for others, because we'd like to deploy them to all of our clinics. This is causing hundreds of thousands of deaths worldwide, and it's not abating. It's not going away. And so there's a much different condition here where we do need to develop a vaccine at warp speed, as the president says. But I don't get the sense that there's going to be any company out there that is going to shortchange the safety and efficacy requirements. I don't think any company, the FDA certainly wouldn't approve anything that they felt was not safe, which may delay. When people say, well, when's the vaccine going to be ready? I mean, everybody's gunning for the end of the year, but maybe until everybody feels absolutely confident in the vaccine, it might delay the release of it.
Right. So are the antibody tests still available for the public?
Yeah, just you can call the Kuwa Delta hotline. Call your physician. Your physician can order it and have you go to one of Kuwa Delta's phlebotomy laboratories out at our imaging center. You can go out there, have your blood drawn, and we'll do the antibody test and send the results to your physician, who then give them to you. Or you can call the Kuwa Delta hotline, and if you want an antibody test, then the providers fire engine, or so the Kuwa Delta based providers then can order that antibody test.
Okay, so final question on COVID, then we have some other questions outside of COVID. But as we're ramping up towards the holidays, how is Kuwa Delta preparing for that?
Yeah, so we definitely are vaccinating all of our employees and our physicians and advanced practice providers. I got my flu shot a couple days ago. I think it's the first time my shoulder does not hurt.
Oh, I felt great. I didn't have anything.
I barely even felt the shot to begin with, but felt great, no after effects, and actually no muscle ache either. So, but that's the first step in our preparation, is to vaccinate, and we get close to 98-99% vaccination of our providers, and that really is done to protect our patients. Because we know that there will be people that come to the hospital that don't get vaccinated, and we would not want to infect them by having providers or employees that aren't vaccinated. So it starts there. Definitely, launching our campaigns around just cautioning our community and all the things that they should do. I think it's really interesting that everybody's kind of anticipating a light flu season this year, because this will probably be the first flu in decades that we're not going to gather like we have. So many of the Christmas parties, sadly, have been canceled. The Christmas tree auction but the large gatherings, at least the public ones, are just not going to happen. So we're going to be washing our hands, wearing masks, distancing, not gathering in such large groups, and those are the things the flu hates. The flu loves you to congregate and not wash your hands and rub your eyes, and so I think the flu is going to have less success in grabbing hold here. That's certainly what they saw down in New Zealand and Australia, where the winter season kind of first begins. We always watch how their flu season goes. So just getting prepared from that standpoint.
Okay, so last night we received a disturbing email from our our CIO talking about the dangers of ransomware and what is going on right now. And we had a question that came in this morning. I just read about the hospital being targeted by ransomware and how it can turn information into gibberish. So how secure are Kuwa Delta's systems, and do we have a plan if we're targeted?
Yeah, it was a disconcerting email that Doug Leeper, our Chief Information Officer, sent out last night. In fact, I brought it with me. I thought maybe I'd just read it to you a little bit, see if you're interested. And Doug sending this to me after 11 p.m. last night. I talked to him early this morning. He had his IT folks here still at 3:30 in the morning, just preparing for this potential cyber attack. But it says, tonight I received a joint alert from the FBI, HHS, and CISA, which is a division of the U.S. Department of Homeland Security, called the Cybersecurity and Infrastructure Security Agency. This alert referred to cybersecurity intelligence that one of the most feared cyber criminal gangs known for vicious ransomware attacks, the Russian-speaking organization called Ryuk, spelled R-Y-U-K, has plans to attack over 400 healthcare facilities in the U.S. I am aware of about 5 that have been hit in the last week, but since they have not shared the details of their attacks, I cannot be sure that Ryuk was the perpetrator. Back on September 27th, Universal Health Services, UHS, which is a large health system with multiple hospitals was hit by a cyber attack, it literally shut down all of their hospitals' health information systems and access to their electronic health records for 8 days. They even attribute a patient's death to the cyber attack because the providers were not able to access the healthcare records of that individual, which prevented them, I guess, from knowing some critical information about the patient, but ended up dying because of inability to access those records. So that it is real, and it's really interesting that healthcare, hospitals in particular, have now become one of the most popular targets for cyber criminals. California Presbyterian Hospital a few years ago was attacked and paid something like a $1.7 million ransom to the cyber criminals. And so they know that they can cripple a hospital's system, and so they feel that, you know, we're a vulnerable target. We actually, a few years ago, we received a vicious attack. It encrypted some of our health information. We were asked to pay a ransom, and we refused to. And so we segregated off that information into a safe area, and probably will never have to access it again. It was kind of some older records, but it happens. I mean, it happens here. But we have an incredible team of IT experts. We work with incredibly talented, experienced outside consultants that have created layers and layers and layers of firewalls and other protection. We have IT folks they're just dedicated to that. That's what they do. We conduct phishing exercises throughout the year, and I know it sounds maybe a little mean, but we need our employees. You know, when you have 5,000 employees and 700 plus physicians and APPs, they need to be incredibly vigilant here. Yeah. So, and these cyber criminals are clever. They're very, very clever, and so Daniel and his colleagues will create usually 6 to 10 different fake, emails that they look so real. They look like they're coming.
I have fallen for it before, and I went on a list.
You're in good company, unfortunately, but they look so real, and they tell you, click on here, and unfortunately, people will give up their credentials, their password, their username, and then that's how they get into your systems. And so we make certain that. And it's okay. Now we've got people so gun shy that they're afraid to open any email, and frankly, that's okay. Because I'd rather err on that side than not being worried. We don't like people bringing in their own personal flash drives. That's a very famous. Somebody brought in a flash drive from home, and it had malware on it, and they plug it in, and boom, the encryption just starts going through. So it's real stuff, but again, every day we're probably being attacked, every single day. But again, we have very sophisticated people and systems to protect our organization.
Well, due to my job, most of my emails come from outside of the district, community members, so I have to be very careful. And a coworker shared with me today that she got an email this morning from Gary Hipst. And she's like, I had to look at it really closely to make sure that I was seeing the R, and I wasn't seeing the R, so I stared at it. Yeah. So they are coming at us from all directions.
I learned a new term. That's called spear phishing.
Spear phishing.
So phishing is just general, I'm just out there trying to dupe somebody into clicking onto this thing. Spear phishing is when they actually use people that are key executives in organizations, and they try to mimic that Gary is sending me an email, and it'll ask for information, or I need you to do this or something, and like, well, wow, that's real. That's from Gary, and Gary's the CEO. I, better do what he.
Gary needs me to wire him $6 million right now.
those do happen. But
Yeah.
when I was a CFO, I would get those all the time from Lindsay.
Mm.
And I'm going, this doesn't sound like Lindsay. And I would call, and he goes, no, I never sent you an email. And but yeah, that you got to be just super vigilant, super skeptical. I hate to live in a world that we can't trust.
Yeah.
But I'm sorry, that's just the environment we have right now, and there's just bad people out there.
Right. So a community member wants to know if negotiations are continuing between Aetna Insurance and Kuwa Delta Visalia Medical Clinic. So if you have that insurance, you cannot go to a KDH facility, walk-in clinic, or VMC. So she's had calls, canceling appointments, has been told that cash pay is not even accepted. So many of her friends with the Aetna insurance are very frustrated and would like to know if we're continuing negotiations.
Yeah, and the short answer is yes and no. So the Kuwa Delta Medical Foundation, who is partnered with Visalia Medical Clinic, while they are part of the Kuwa Delta Health System, they technically are a separate organization, a separate corporation, and it has its own contract with Aetna that is separate from the contract that Kuwa Delta, the medical center, and its facilities have with Aetna. So with respect to the Kuwa Delta Medical Foundation and Visalia Medical Clinic, Aetna has been one of the poorest paying insurance companies under contract with VMC and now the Medical Foundation for years. They pay significantly below to physicians compared to what Blue Cross or Blue Shield or Cigna, every other health insurance plan. And so we've been negotiating to try to increase that rate, not even to make it equal to, but just to start getting closer and to maybe do it over a period of time. But Aetna has dug in and just refused to budge. And so, unfortunately, the Kuwa Delta Medical Foundation and VMC said, okay, that's it then. We're not going to continue to see your patients and accept these kind of rates that we can't even cover our physicians' salaries, and their benefits, and let alone the cost of the staff and drugs and supplies. And so on September 27th, the Medical Foundation formally terminated its agreement with Aetna. Now, there weren't, relatively speaking, a tremendous number of patients of Visalia Medical Clinic that were under that Aetna contract. And I do know that Visalia Medical Clinic is working to try to, place those patients with other providers, and definitely those, that maybe were more chronically ill, trying to work with them.
Mm-hmm.
I can't say that those negotiations will never reopen, because a lot of times it takes something like this to trigger,
right.
To tell Aetna, no, we're serious. We're willing to walk away. We're that serious. And so, unfortunately, that's a common tactic that both the health plans play and providers play, because it's the only way you really get their attention.
Mm-hmm.
You saw that play out a few years ago with Anthem Blue Cross and Valley Children's.
Mm-hmm.
And they finally reconciled and came together. So that's with respect to the Medical Foundation, and certainly that employer, those employees that were largely seeing doctors at VMC, that is a disruption, definitely.
Okay.
Now, with respect to Kuwa Delta and all its facilities, so the Kuwa Delta Medical Center, all of our clinics in Exeter and Lindsay and Woodlake and Dinuba, our family medicine clinic, next to the helipad, our two urgent care centers on Court Street and Demery, our Sequoia Cardiology Clinic on our West Campus, all of those facilities and all the providers in them continue to be fully contract with Aetna. All products, their HMO, their PPO. So yeah, you absolutely can continue to come to all those facilities, and it's under full contract. And if you're having difficulty with that, certainly let me know.
Mm-hmm.
I don't know if Aetna is providing misinformation out there, but
Yeah.
Kuwa Delta continues to be fully under contract.
Yeah, because she says KDH facility, walk-in clinic, or VMC, and Wells Fargo is one of the larger employers in the area.
Yeah.
And so that's what they...
Well, now, so Sequoia Prompt Care over on Ben Maddox is a Kuwa Delta Medical Foundation VMC provider. So they would be affected as a walk-in clinic there.
Okay.
But the walk-in clinics on Court Street and Demery are unaffected by this, and you absolutely can continue to go there as a Wells Fargo employee if Aetna is your insurance.
Okay. So, Gary, we had a tragedy at our rehab hospital this week, and so I just wanted to kind of give you a couple of minutes to address that.
Yeah.
I know it was in the news, but...
incredibly sad. Unfortunately, a husband and wife, elderly in their 80s, were coming to the rehab hospital to receive outpatient therapy. The wife was the patient, and her husband was pushing her in a wheelchair. They had parked their car and were making their way towards the facility when another patient of the facility, a gentleman, I think a relatively elderly gentleman himself, was also coming for outpatient therapy, and came into the parking lot at a rather high speed. And we don't know the exact circumstances. I certainly don't know. I know the police are continuing to investigate it. But apparently came hard around the corner down the lane of parking spaces and hit the husband and wife. And unfortunately, the husband did not survive. They both were rushed to the Kuwa Delta emergency room. And despite the incredible work of our ER physicians and the staff, they were not able to save the husband. So, yeah, our hearts bleed for them. As I said the other day, I mean, never could you imagine, never in a million years, I'm coming out to a place to receive care, to be healed. You know, I'm
in a parking lot.
Yeah, you just don't think about that, and just the fragility of life. And so our deepest sympathy and thoughts and prayers to both families, because I know the gentleman that was driving the car was incredibly distraught. You know, I mean, that's a life-changing event for him as well. When you've taken the life of another person, I just can't imagine how he must be feeling, but then obviously the family. I do want a shout out to our clergy. I mean, they were on the spot immediately. They were out at the rehab hospital, comforting people, comforting all those that had witnessed it and were kind of traumatized by it, but also comforting people in the emergency department. The wife's wheelchair was severely damaged, and we found her a brand new one. The ED staff and the clergy bought her a brand new wheelchair and gave it to her, and I know she really appreciated it, the family appreciated it, but then also just the employees, the men and women that work at Sequoia Surgery Center and the rehab hospital, our emergency department, our clergy staff, even some of our folks in the West Campus Medical Office building. I mean, they came rushing out immediately, without hesitation, and providing first aid and comfort to the husband and wife, and it's just amazing, And
our rehab team, they don't see trauma like that, so it had to be very.
It just makes you just really, really admire people like that. I mean, they're the first responders that rush into a burning building. They rush to accidents and tragedies, and just have great respect and appreciation to them. So yeah, very, very sad.
Okay, well, our time is up. So, Gary, thank you and all of the team behind the scenes. And I do want to end it, although not to take away from the horrible story. Randy Groom has said, Gary, I think if you want to pull off
Randy.
the 50s theme, you should go as Richie Cunningham. Yeah. So thank you, Randy, for that. I think that's a great idea. And you guys all have a happy and safe Halloween. And we'll see you back here in 2 weeks. So thank you.
All right.
Thank you all.
Thank you all.